Hi, I'm Dr. Charles Heuser, and we want to talk to. I'm a chiropractor, and my brother also is a chiropractor, but he's more than that. He's a functional neurologist, and so he treats conditions beyond what most chiropractors treat. And I think you're going to be amazed. So, just so you know, David, can you tell me what the difference is between what you do and what a regular medical neurologist might do?
So a medical neurologist is very good at what they call ablative lesions and diagnosing ablative lesions. And those would be the people who have strokes and they have tumors and they might have MS, so that these are actual problems with the anatomy. Their job is to diagnose. They will treat it with medication, but beyond that point, they don't do a lot. We specialize in going beyond that point and actually rehabilitating the nervous system. If there's not an ablative lesion, but a person is still having the problems, we can retrain that. If there is an ablative lesion, we can teach the nervous system to function even in the presence of that. So even though you may have damage from having a stroke, we can use the parts of the brain that work to teach you to recover. It's pretty well researched and pretty well published in the scientific literature, the resiliency and the ability of the brain to recover from these traumas and injuries.
By that, do you mean neuroplasticity? And can you give us some examples of neuroplasticity?
Okay, so neuroplasticity happens all the time, and that is how we learn anything that occurs. So if you're learning a new card game, what happens is you form new connections in your brain that lets you understand the card game, evaluate it, and go ahead and play appropriately. If you're in a new town, the neuroplasticity lets you learn new things. If you have a part of your brain that doesn't work very well, neuroplasticity teaches your brain how to go ahead and work in that situation. So neuroplasticity is the way that your brain changes in the face of anything that challenges it.
So if somebody has a blood clot or a stroke and it's blocking a part of their brain, and I use that term so that the people out there that are watching it can understand, could you help teach the brain to go around that clot, or how does that work?
So what happens is, let's say, I'm not going to go into too much detail. Let's say you have a stroke of the middle cerebral artery, and what that does is takes out a big section of the brain. First thing, of course, that you want to do is you want to make sure you're going to live. The medical neurologist make sure that that's what they do the best. And then what they will do is they do I would say rudimentary rehabilitation. They teach you to work around your impairment, work around your disability. But the brain is pretty resilient, and with the right type of stimulation, with the right type of demands put upon it, it learns how to form new pathways and new ways of working so that you can function against it. The brain can regain control and operate the way that you want it to.
Can you give us some examples of some common conditions that neurologists might see that maybe the patient is not getting as well as they'd like to be, or is not as well as they'd like to be, and that you would be able to help them with?
So migraine headaches, anxiety, high blood pressure, gut dysfunction, movement disorders, tremors, slowness of movement, history of falling. These are all failure of the brain's ability to navigate through the world and generate appropriate responses to the challenges that it gets. And the problem is, once you go down that road, sometimes you need specific interventions, or you just start layering on a compensation on a compensation on a compensation. People can do pretty well with that unless they have something happens that interferes with their ability to compensate. So as an example, a person might have had a concussion when they were 20 and they were never rehabilitated, but they developed strategies to cope with those weaknesses and they managed to do pretty well. But now that they're 40, they might have another concussion, or they might have bad diet, or they might be under a lot of stress. They can't compensate anymore. So now they start to get migraine headaches. They start to have vision problems. Their blood pressure goes up. They start to have recurrent anxiety. far more common than what people realize. And so the key to that is the question always to ask is, why is this patient here in front of me in this way at this time? What is it that brought them to this point? Otherwise, all you know is that what you have in front of you. But once you understand what it is that brought them to that point, then you can a lot of times develop strategies that we can do in our office and they can do at home on their own to go ahead and regain their life and regain control of it.
So we treat, at my office, we treat a lot of people that have been in automobile accidents, and they come to us. We're pretty good about getting their neck to function normally and their low back to function normally, but I've noticed that a lot of those people are developing or have developed brain fog, ringing in ears, severe anxiety. They may have even had anxiety before, but now it's on steroids, depression, PTSD-like symptoms.
Yeah.
So are those things that maybe we could help with? I mean, I've even had patients that they're unable to actually even go back to work, even though their spine is functioning normally, but their brain is just not functioning normally. So a little bit about that.
I'll give you an example of that. So one of the most frequent things that happens when people have car accidents, they have spinal injuries. But one area that gets involved a lot is what's called your vestibular system. And so that's your inner ear, but also all the central connections that tell you where you are in space and where you're moving, which way is up and which way is down. So you can fix the spine, but if that vestibular system is left with a dysfunction, now you have to navigate through the world and you're not exactly sure, am I standing upright? You're not exactly sure how far that you're moving. You're not exactly sure if you even are moving. You may have a sense of movement even though you don't. You start to get vision disturbances. And believe me, that is going to give you a sense of brain fog. If you don't know who you are and where you are, you're not going to be able to think at a higher level. If you don't know who you are and where you are, you're going to have a lot of anxiety about moving through the environment. If you don't know who you are and where you are, you're going to have trouble with accuracy of movement. So that's a very common injury is into the vestibular system. It's overlooked a lot. And this is why you talk to so many people. Yeah, I had a car accident 20 years ago and I kind of do okay, but I still have headaches. I still get stiff necks. I still get shoulder pain, and I'm starting to feel a little unsteady on my feet. So, I mean, very, very common. There's people who develop problems with coordinated movement of their eyes. It's called your ocular motor system. And now their brain has to deal with some double imaging. And so it suppresses vision. You don't have binocular vision. You have trouble with depth perception. That's going to give you a little bit of anxiety. That's going to give you some brain fog. It's going to make you always work with your neck to try and strain to bring things into focus. So these disorders of these different systems, other than just your musculoskeletal and your spinal system, have to be addressed. When you have a car accident, if you were in a car accident sufficient to cause damage into your, concussion, brainstem concussion, you for sure have hurt your neck. So the neck hurts the most, so people go for that, but it's not sufficient to really recover completely. You have to make sure that all those issues are addressed, or you're going to be vulnerable to recurrences, ongoing impairment in terms of your ability to work throughout the course of the day.
So I noticed that a lot of people in my practice and people that I've treated have been in car accidents, and the doctor, the medical doctor, the emergency room, and even the chiropractor didn't recognize that they also have a concussion. So how common is it for somebody to have a concussion that's been in a car accident?
I would say it's fairly common. And a lot of times people do recover from concussions, but a lot of times they don't. So I think it's a pretty common sequela, and you might feel it's headaches if you're a little crappy, you got a lot of nausea, I feel unsteady, and, that I think it happens a lot.
So if there's the people that are watching this out there, is there any easy self-tests they can do that may help them to show them that they may have a concussion. And maybe not for sure, but maybe that's an indication that there may be a concussion there, and maybe it should be checked out by a chiropractor or a functional neurologist.
Well, what we do when we see patients in your office is we use a form called an SF-46, which is a list of symptomatology that are grouped into all the different areas. And when we see a score on that short form that tells us there's a problem in this area, there's a strong probability that that area, for instance, your vestibular system is not working appropriately, your systems of emotional affect aren't working appropriately, or your somatosensory, which is your musculoskeletal system, isn't working appropriately, or your autonomic system isn't working appropriately, and so you're getting digestive problems, light sensitivity, migraines, headaches. That would be probably the simplest and the quickest and the easy way to do it, is to do it based on groupings of symptoms on a questionnaire like that.
So do you think that, do you think it would be okay if they wanted to call our office or contact our office with email or something like that and request a form like that? Is that something that could be done, and they can send it back?
Yeah, I think we can evaluate. I think they can do that, and one of three things will happen. One is, yeah, you got a problem, you should address it. When you don't have a problem, you don't need to address it. And one is there may be a problem. So, if you're going to fall in any one of those categories, if you don't have a problem, you want to know that. Got a problem, you want to know that. If it's in the middle, you want to know that too. And then you're more likely to be able to take appropriate action to address whatever you have.
Okay, so I want to move on to another subject. So you're kind of famous for treating pretty difficult type problems. And so problems like multiple sclerosis, problems like Parkinson's, similar conditions. Number one, can you help those? And number two, is there a quick fix, or is this a slow process?
So
Can you talk a little bit about?
So those are chronic, long-term conditions. And those are what we call ablative lesions, but they're also progressive decisions or problems. We can't cure the multiple sclerosis, but we can improve the functionality of the person immensely. So we can take someone who's quite impaired and disabled from the multiple sclerosis and give them their function back. They still have the multiple sclerosis, but it's not manifesting in them in nearly the same way that it was. And it's the same thing with Parkinsonian problems, is that people who can barely walk, and we don't take the Parkinsonian problem away. That's a dopamine production problems. But what we can do is there's alternate ways to make those systems work other than through the dopamine pathway. If we can do that, then your tremors will do better, your gait will do better, your speech will do better, your life will be better, you'll probably live longer.
So that I realize that there's no guarantee when you're treating somebody. I've been a doctor way too long, but is the probability high, even though they're not going to be 100%, but their lives will be improved? And like, what kind of probability? A high probability?
I would say pretty high, but the probability goes way, way up within a few visits, and I see the response. This approach is not something like, we're going to work 6 months and then we'll see if you're doing any better. What this approach is, we're going to work today and the next few days. And, if this goes as expected, you'll start seeing positive changes in your ability to function. That doesn't mean that you're done, but then you'll at least know that this is a pathway that's going to be an avenue for you to have a better life.
Okay. So just one more question. If somebody has a question specific, can they send us the question, and you'll be able to hopefully try to answer it or to answer?
I don't mind answering questions, and I may not get back to you right away, but you know what? I tell you what, is I do this to help as many people as I can, and if answering questions will help people have a better life, I'd be glad to do that.
So they can call my office, or they can email my office, and we can get that question to you. One last thing. So once they're in here and we get them working, they're working towards their goal, and it looks like the probability is high they're going to improve. they can take some of this and do a lot of this they can do in their house or their home. Am I right?
That's a necessity. So it's like anytime you're learning a new skill, let's say that you've never played tennis before, never played golf before, and you can go into, you get a lesson, and you play a little bit better, but if you practice that lesson over the next week, you get better, and then you go and get another lesson, and you practice that for a week, and you go and get another lesson. So what we're going to do is when you come in, we're going to see, what are you doing, what's working, what's not working. We did this, what's not working did better. You're going to be working on this at home. And as that improves, then what we'll see, the things will change. We don't need to keep working on this. You can hit a forehand now. No, we need to work on your backhand. Now we need to work on your overhead. Now we need to work on you lobbing the ball. Now you're doing that well. And it's a progression, but the real practice is at home. And the real instruction and the assessment, the evaluation, prescription comes when you're in the office.
So this is our first YouTube video that Dr. David and myself have done, and we're going to do a series of them. So we're hoping that you'll send in the questions that you might have, and we'll answer some questions in the video. And I know that I have a bunch more questions to ask. So do you have anything else you want to say? What conditions are the most common that you might see and you might treat?
Okay, I would say movement disorders, people with tremors, people with Parkinson's, headaches, migrainous headaches, and anxiety would be a really big one.
All right, thanks.
Yeah.
See you next time.